All right, Dr. Emer, we are live.
You can feel the previous stuff. Hey guys, it's Dr. Emer, and we're doing some hip dip improvement or buttock, let's say buttock volumization using SCULPTRA right now. We've done some fillers before actually, and I can feel it in there. I can feel the collagen production for my client using both Radiesse and Velafil in here before. Now we're gonna kind of seed the area with SCULPTRA. You guys know I call this kind of the snow globe filler because it's not really a filler, but it does build over time this area and makes it more robust, more lifted. You just need to do a pretty good amount of it. That's the issue. So you take a look here, we're using diluted SCULPTRA, which is basically little beads that are diluted into this solution, and then the solution seeds the area with the beads and they build collagen over time.
Dr. Orion here saying the man himself.
Hey guys, what's up, Dr. Orion? We were just talking about you. So, and you guys can see right now it fills the area out. It looks much more prominent because of the volume that's here, but it's going to go down. But it's going to allow her, as she works out and does body treatments like True Sculpt and Body Tone, it's going to kind of build the area up. And the most important thing in this next phase is just to massage the area a little bit as we do the treatment, because we want those particles to go in there and to build. And so they just need to build the area. And this is really good for my fitness patients, my patients that are a lot leaner, or who've done a BBL, let's say, and you want to build some more volume in the BBL, or the BBL didn't survive. You can use this to kind of build a little bit more volume. It definitely requires a lot. That's the only negative, although I have patients will do a small amount of it for maintenance.
Some of the doctors around here asking, what are you doing?
Tell them.
Guys, we're using SCULPTRA, which is diluted right now. We're using it to help stimulate collagen production, help fat survive, build volume in the hip dips. We've done other filler treatments before for her. You've seen it on our reels. You guys have seen the before and afters before. Now we're just trying to keep building and keep volume.
Exactly. So this is our maintenance plan, and you know it's really good for those that work out a lot because it helps to build upon the exercising, or if you're not exercising, this will help maintain volume for the area. But I really want her to have enough, specifically on the outer portion, which is why I'm focused on her kind of turn this way, so we can get the specific outer portion here. And you guys know some people call this non-surgical buttock augmentation. It does improve cellulite somewhat, which is good. It also, I use it when I do Selfina for cellulite because it enhances the Selfina. Actually, the lady that we did 2 weeks ago with Selfina just came back and almost all the cellulite's gone. She couldn't even believe it. I couldn't even believe it. But I feel like a lot of it has to do with the fact we also added the SCULPTRA, which she needed. So you guys see we kind of get a bunch in there. We want it to blend in this area, so just building it, then we're going to massage it.
Is there a chance of vascular occlusion?
Not really with SCULPTRA, you guys, because SCULPTRA is a particle. It's not an actual filler. So I just don't think that's even possible because it's a solution.
We have some of our friends in Fifth and Wellness tuning in on here.
All right, come lay flat for a second.
How much milliliters are you using? We're not going to tell you specific parameters of our treatment.
See, if you look here now from the top, how much we actually filled it out. So now what I'm going to do is blend the area from the lower portion because we really filled the hips a ton.
How many have you used, they're asking? Must be some providers
We're
on
doing
here.
about 10 aside, you guys. We're doing a large volume today because she's in the perfect time right now. She's doing a little more resting, so all her systems are building collagen and building up volume right now. So you guys can see we're kind of blending now the full areas. So we did the hip dips. You guys can see the roundedness there. So now I'm going to fill out this lateral portion of the buttock as well, which blends the whole area.
a lot of YouTubers on here.
So you guys, this is a great treatment for anyone that exercises or just wants a little bit of improvement in their buttock. Even if it's something you do just a couple times a year, a small amount for a boost, it's very valuable. But we're doing a larger volume today, so she's gonna look a little crazy with the fluid. When it goes down, it's gonna look great. You have to dilute it this way, unfortunately. There's no other option. You guys can see how robust it looks. But in the next couple months, it's really gonna help her build. And I can actually feel in the hip dip where we've done other fillers before, I can feel the thickening there. It's a lot harder to get the SCULPTRA in. What are they saying, Jordan?
Don't have too many comments. We got a lot of viewers actually.
They're just watching.
Someone is actually saying, "Hi, doctor. My friend's penis so little. Can you help?" Yes, guys, we can. Someone really asked about their
friend.
friend.
The buttock, we can do that area too.
Guys, so it says a DM, full name, email, and phone number. People are saying hi, hello,
They're
everybody.
asking for their friend's penis, not for their own. I mean, who's showing their friends their penises?
I know. They must not be friends. They must be more than friends.
Very good friends, or they just are very good friends.
Someone said that gets rid of hip dips? Question mark. Yes, guys. This helps build collagen and add volume in the hip dips. We can also combine this with other fillers, such as Bellafill for our Bella Lift, which is going to add immediate volume, then stimulate more collagen production on top. I just need to get my eyebrows. Is it possible because I both have a lot of gap? We can use several things to eyebrows here. We can do stuff with threads. We can put fillers in there. Guys, come see us. Send us a DM, full name, email, phone number. Let's get you the right treatment.
This one's clogged.
Is this Renuva or Sculptra? This is Sculptra, guys. Renuva would look very different.
Yeah, Renuva is a synthetic, sort of a synthetic fat injector. It's more of a matrix per se. It helps build fat in the area, but it doesn't always work, and especially on very thin women, it tends to not do as well because they don't have a lot of fat to begin with. So I find that the Sculptra with other fillers is better.
Our questions are coming in now. How much is the consultation? It depends on. We have free consultation in office with our lovely coordinators. We also have virtual consultations with Dr. Emer, and the coordinators are in person. We have skincare consultation as well, guys. Go to our website, get virtual consultations at jasonemermd.com or Emerage Cosmetics, or just send us a DM. Someone saying, did she already have a BBL?
She already works out a ton, you guys. So her body is working out.
How many injections can you do? Is she awake? What's the end goal here? How long?
She's saying hi.
She's saying hi to you guys. She's awake. Don't worry, just topically numb. This is an easy in and out treatment we can do in the office. How many sculptures are you injecting? We're doing about 10 aside, should we say?
Yep, so it is a large volume.
We'll say it looks great so far.
So it's going to take a little bit more time.
Can this be used to build a shelf booty?
Yes, it can actually. Just depends on what your starting point is. So we'd have to take a look and see. And it depends on how much you need. With your hip dips, it requires a little bit more. Keep going. So we just keep going. And you can actually add other fillers to this too. I just think for her, given that she metabolizes things so quickly, working out so much and being a lot slimmer, this is a better option for her.
How long does this last?
2 to 3 years. So just depends on how much we do and what results you want to get.
How quick your body metabolizes. Let's see. Can this be done if you've had a BBL? Yes, guys, we highly recommend this after a BBL. It helps the fat, it really helps the fat survive, and it helps collagen build even more, so it gives you enhanced results. Some patients don't have enough fat for fat grafting to get their desired results, so we can use this in combination with other fillers on top.
Exactly.
We use this in many other areas of the body to help build collagen as well. We do it in the face.
So I'll finish this side so you guys can see the difference. You can see there's a lot of volume in there. I'm blending off the sides now because I want to make sure this is on.
Let's go up top, give you guys a top view right here.
And we do a little on the top just to blend everything so it stays rounded.
Let's see a huge difference over here in the top view.
Yeah, a lot of it's the
What
fluid.
filler are you using, guys? We're using SCULPTRA, which is our snow globe filler. We're trying to boost collagen production for our patient. After 2 years, will anything stay?
I mean, yeah, she'll have more collagen, but the effect of the collagen production is gone at that time.
So what is this called? This is SCULPTRA that we're using.
Non-surgical buttock augmentation.
This is our non-surgical buttock. We have a few different methods to do it. This is one of the ways we like to do it. But again, every patient's different, so we'll help you choose which way is best to help you get your goals.
Almost done on this side. Are you feeling any? Good. Good.
How much, please, guys? It depends on the amount that we're going to do for you. To get that, guys, send us a DM, full name, email, phone number. We'll have our team reach out and get you the cost.
few more remaining, so now I'm gonna get a little bit on the lower support.
What's this for again? This is for collagen production to help fill in our patient's hip dips. Can we ask unrelated questions to this procedure?
No.
You can if you DM us and you want to talk to our team, they'll answer whatever you need.
Exactly.
People said fill her up.
That's nice of them.
Recovery time for this?
Nothing. You get bruising, but other than that, nothing. You can work out. Even the next day.
No downtime, guys. How many syringes are recommended per cheek?
Just depends.
It depends on the
You can't-
dilution, I guess.
No, it depends on their starting point.
The
They
starting
have no
point.
idea how much they need and how much they want to afford or how much they want, what their goals are. It has nothing to do with the syringes, it has to do with your goals.
I'm asking how many vials can you put in one side?
As much as you want.
How many days should she not sit down for?
No restriction. No restriction.
Are you going to post this video after? Yes, guys, we will. You can watch it again and again and then come see it in office.
And then we want, from here, we're going to want, our team will massage her lightly. And she'll do red light. And that's it. And she can go.
What can we do to help minimize bruising?
It's not a lot. I mean, the arnica pills, you can put vitamin C, my AOC on here, and then red light at home. That's the biggest the biggest things that you can do. This is it for this side?
Yeah, no, just one more.
And then we'll finish.
Can you
Show
take?
guys.
It looks amazing.
Is she sleeping or numb? She has been topically numbed in the area. She is
No.
wide awake.
She can say hello and wave.
Hello, no sleeping.
They're like so scared for you.
Oh, I'm here. I'm
She's
alive.
here, she's alive, she's ready to go back and work out because they told her she could. Okay.
I'm gonna stand. You
So-
keep getting foam. So
Time
keep
to shut
going.
it down.
Alright, we're gonna go. I'm gonna come over there.
All right, we're gonna switch sides, guys. Dr. Owen's gonna do the other side.
My,
Can you take-
my team's gonna stay on this side. What?
Can you take a picture of her head?
What, you can? Yeah. So you're gonna come over here. Bianca, you're gonna be over here. Gonna take the products over here.
Do you have
You're
age
gonna
limits?
massage her while you give me the-
They want to know if we have age limits for these treatments. You have to be 18 or have a
Well,
parent's
they need
consent.
to do treatment, that's it. Sorry. Good. So you're gonna start handing me those. We're gonna massage her while we start. And we're gonna go from there. And we'll turn
Aaron.
to this side again. So keep it always facing up. And then the space in between.
People are saying beautiful job when they saw those overhead results.
So we're gonna start now. Okay.
Dr. Emer, do you go to New York often?
We're gonna be there.
Well,
Tell 'em, Jordan.
Guys, we fly out tomorrow afternoon to New York. There might be a couple slots left if you're lucky, guys. Send us a DM, full name, email, and phone number, and we'll try to get you in. Or not, we do go about every other month.
Every 2 months we'll be there. I think it's booked, but you guys can try.
You might get lucky.
Doesn't hurt to try. Try to get in.
Is it like petroleum jelly?
No. This is fluid. This is water. This is like water.
What are you injecting? This is SCULPTRA, guys, to stimulate collagen
So
production.
you guys can see the beads in there that builds collagen.
Check
That's
'em out.
PLLA.
Is he a plastic surgeon? No, he's a dermatologist.
Board certified dermatologist. Many years.
If you do need plastic surgery, we do have plastic surgeons in our group for you.
Oh yes.
Plenty of very skilled ones. How long will this last? This lasts about 2 years.
That's finished.
Good?
Yep. Alright you guys, so we'll show you results in the next few months as she improves, but keep following along for other non-surgical buttock augmentation. Bye guys.